This is an ultrasound study of a 24 years Paris female, where you are seeing the uterus in longitudinal section with central clear endometrial canal, the uterus measuring 9.0 by 3.9 centimeters, and this area, the lower segment, is being stretched by mass, heterogeneous complex mass measuring approximately I will say 10 into 10 centimeters, rather more than that. And this is the endometrial canal, and she is in the mid-cycle. This is a complex, solid cystic mass with internal calcifications that I will be showing you later on. This is the fundus of the uterus, the body of the uterus, lower segment, and the cervix. These, you see, is being stretched, and the uterus is anterior to this mass, and the mass effect is that only to the extent that this lower segment is being stretched. Otherwise, she has no menstrual disorder, no history of menstrual irregularity. Now, mid-cycle uterus. This is a mid-cycle uterus. Now, when I move the probe transversely, you will see that the uterus is mid-cycle. Here we are. This is the transverse section of the uterus. This is the endometrial canal in mid-cycle. Now, this is the left ovary, and this is the right ovary. This one. This is the right ovary. These are the follicles, developing follicles within it. And this is the mass. It's a large mass in the pelvic cavity. Now see the appearance of the mass only. It's a solid, complex mass with areas of internal, there are internal cystic areas. This is cystic area, this is a cystic area, and this is the calcification as well, and there are islands of echogenic material scattered throughout this complex mass. And the mass is well demarcated. Its outer surface is seen. This is the outer surface. It's well demarcated mass, and it does not give any mass effect on any other part. And now I am giving a almost 180-degree sweep to the probe to show you that the mass does not change its shape, remains almost the same for its internal configuration. However, I am going to magnify and show you the mass in total. So now this is the pelvic mass. Here it measures. This will be an accurate measurement now. Approximately 10.5 into 11 into 3 centimeters, and it's complex, cystic and solid, because you can see that there are few cystic areas scattered. These are all cystic, these are tiny calcifications, and now this is the uterus. Now this is the fundus of the uterus, and the lower segment, the mass. This is the mass. She has no difficulty in maturation, no complaint of, as you see that the urinary bladder is collapsed. I did saw this patient with full bladder with nothing significant, and it was difficult to get to the total dimension of the mass, so I had to have her, I asked her to empty the urinary bladder, and then I saw this, I was able to see this complex mass in total along with the uterus. Here we are. So this is a case study of a complex pelvic mass in a 24-year-old female.